Good afternoon, I'm Lauren Casey. The Johnson & Johnson COVID-19 vaccine is now paused nationwide after a handful of cases of blood clots in women who received that shot. The FDA recommends the pause this morning, and now the Indiana State Department of Health has made the same recommendation to its pharmacies, giving out that single-shot vaccine. The announcement came less than 2 hours before another mass vaccination clinic was set to open right here at the Indianapolis Motor Speedway. We do have live team coverage this midday out from IMS. Coming up, we'll hear from our Megan Shin, who spoke to people outside of the track who are already lining up to get their vaccines this morning. But first, we want to go inside the track to WRTV's Nikki DeMentry with more on the last-minute shift health officials made to get another vaccine to Hoosiers out there today. Nikki, good afternoon.
Hey, good afternoon, Lauren. What they told us this morning, officials say they're moving fast just like we're moving fast here. You can see behind me inside Indianapolis Motor Speedway, there are some folks waiting for the Moderna vaccine. This was supposed to be a Johnson & Johnson mass vaccination clinic this month, but that did not happen because of the FDA and CDC recommending immediate pause in all of this. Now, we spoke with Dr. Lindsay Weaver with the State Health Department just really a few hundred yards from here earlier this morning. She told us at that time there was a line outside, and 95% of Hoosiers that were lined up did agree to take the Moderna vaccine. Now, as you mentioned, the news came down barely 2 hours before the mass vaccination clinic was set to start here at the Indianapolis Motor Speedway. And as you may know, the clinic is set for 16 days here this month, and the goal is 6,000 vaccines a day. That was supposed to be with the Johnson & Johnson vaccine. Now, the halt is in using the J&J vaccine, I should say, will be statewide. Hoosiers signed up to get vaccinated here at IMS received a text message explaining the switch to Moderna this morning. Now, second doses will happen for those here at IMS, Weaver says. It's just unclear where in Indianapolis those will take place. Now, other clinics using the J&J vaccine outside of IMS will also be getting either Moderna or the Pfizer vaccine. Some locations, though, Weaver says, may cancel today's clinic. It is important to note, though, 6 cases out of almost 7 million vaccinations with the Johnson & Johnson vaccine nationwide are in question here. And while the problem appears to be extremely rare, it is a serious blood clotting issue. I asked Dr. Weaver to tell us her message to the more than 125,000 Hoosiers who have already gotten the Johnson & Johnson vaccine. This is what she had to say.
I think that they can be rest assured that this seems to be extremely rare, at least. However, if you do develop a headache, shortness of breath, chest pain, any of those things in the 3 weeks after you got your vaccine, then yes, you need to seek health care and talk to your healthcare provider.
Now, for those with appointments here at IMS later this week or even this month, Dr. Weaver says don't cancel that appointment just yet. She also stresses the importance of getting vaccinated as the state sees an increase in cases, possible rise in hospitalizations, and the spread of variants across the country. It's not clear, though, how long this pause is in place for, but Dr. Weaver says for now it is indefinite. The state plans to meet later today. Now, taking a look back here inside IMS this afternoon, you see actually the cars went in to get their Moderna vaccine. Again, Dr. Weaver said when we spoke to her around 9 this morning, 95% of Hoosiers that were lined up outside said they agreed to get the Moderna vaccine. They will have to get that second dose. And as you mentioned, Lauren, our colleague Megan Shin has been outside all morning talking to Hoosiers that are waiting to get their vaccine here. Megan, what is it looking like outside? How are the lines?
Well, Nikki, outside here at the Indianapolis Motor Speedway, the line is moving very smoothly at this point. It was bumper to bumper earlier, and just about an hour after they opened the gates here at Gate 2, we know the CDC and FDA held a joint press conference, and during it, they say that all 6 severe blood clot cases showed up in people ages 18 to 48 within 6 to 13 days after getting the vaccine. And as of yesterday, out of the total number of Hoosiers who have been fully vaccinated, so far, 9% of them received the Johnson & Johnson vaccine. The other 2 vaccines, as you said, Pfizer and Moderna, are still available for the community. CDC and FDA experts say it may be a bit bumpy to reschedule vaccinations at facilities across the country that need to switch away from the J&J vaccine. However, people we spoke with in line say they're grateful for the change that happened quickly here at IMS.
A second later, I got a text from the IMS saying they're switching to the Moderna.
Think it's good?
So, yeah, I think it's fine. I trust them.
I think safety comes first.
I don't actually mind too much.
I think it's a good idea.
Good. Do you feel safer with that?
I do, actually. Blood clots had me kind of concerned.
I was nervous. I talked to my younger sister who's a doctor, and she assured me that it would be okay because I'm on blood thinners, but it was concerning, so I'm happy.
As for how long the pause on the Johnson & Johnson vaccine will be, the FDA says the investigation will at least continue or start in the next few days, so we'll keep an eye on that. And as for the White House coronavirus advisor, well, that person says that the overall pause on the J&J vaccine will not have a significant impact on the overall vaccination in our country. Live at the Indianapolis Motor Speedway, I'm Megan Shin, WRTV.
Megan, thank you. I want to thank Nikki as well this midday. Now, if there's any long-term stoppage of the Johnson & Johnson vaccine, that could complicate the plans to vaccinate Hoosiers as quickly as possible here. It was just last week that Governor Eric Holcomb dropped the statewide mask mandate as well as the state-imposed limits on businesses. So today we asked the governor's office if there would be any change to the state's plans because of the possible disruption to vaccine supplies. We got a one-word response from the governor's press secretary. She simply told us no. We'll have more on this developing story from a medical expert coming up later here on the news at noon. Obviously, a big story we'll continue to stay on top of today.